what is it like operating in a Canadian hospital as opposed to a hospital in Africa?
What kind of heart surgery do you perform?
What is a day in the life as a heart surgeon?
Dr. Horne, what's it like working in a hospital in Canada as opposed to Africa?
So that's a good question. We're fortunate in Canada that we work in a healthcare system where everything is basically taken care of by the government. So resources, it's not limitless, but the equipment that we need is always available. So behind me here is the heart-lung machine. So here in our center in Halifax, we have at least 2 of these, where when I go to Africa, not all places have them, and we might have to take that with. The other thing is the consumables, which is the things that we would use to go onto the heart-lung machine and into the patient, and then we discard that in Canada. Where in Africa, they might have to re-sterilize them and reuse them. So many times we've got to take all those consumable equipment with us because they don't have the resources to pay for those things. So the big difference is that we're a resource-rich country where they are resource-poor. Even medications that we need to give the patients during and after heart surgery might not be available. So operating in Africa, we've got to make sure that we take all those medications with us. We're in a little operating room in the IWK right now, and the nice thing here is it's air conditioned. When I go to Kenya, there's no air conditioner either, so we have to cool people down in the room with a fan, and that's in a temperature of like 25 to 30 degrees Celsius. So it's resource poor, and we got to just adjust and make things work.
What kind of heart surgery do you perform?
So we call it open heart surgery when you use the heart-lung machine. And so we do specifically at the Children's Hospital myself. I'm a congenital heart surgeon, meaning I operate on heart conditions that people are born with, that is abnormal, to repair that in different phases of life. The contrast to that in Canada would be acquired heart disease. So that would be people as they get older and their valves would start getting narrowed, or they get disease in their coronary arteries after having a heart attack that we need to do bypass surgery. I do both of those. The adult ones we'll do at the QE2 hospital. When I go to Africa, the surgeries we do there would be lower risk congenital operations. So it's usually what I call holes. So if you have holes between different chambers of the heart, or a very common one is tetralogy of Fallot, those would be the kind of surgeries we would do there.
What is a day in the life of a heart surgeon?
So my day is different from adult cardiac surgeons, being a children's or a congenital heart surgeon. So I'll describe you mine first. My days, every day differs. I operate about 2 to 3 days a week. When I operate, the days would look like this. I would be at the hospital by about 7:15, meet with the family or the patient, and then we'll have a team meeting in the operating room that you saw before the patient goes in and gets put to sleep and we do the operation. The operation will then take anywhere from 4 to 12 hours, depending on what kind of surgery it is. And then we'll come back here in the ICU. So this is one of our ICU rooms at the IWK, where we will then leave the patient in the care of the intensivists that will take care of the patient overnight. So after that, then I do have to do a lot of paperwork on that operation. So I'll go to my office and I'll do some dictation and some computer work, check emails, and then work on some other administrative stuff. So that will take us into the mid to late afternoon. And then I'll usually stay in the hospital for an hour or 2 after the surgery to make sure the patient is stable after the surgery. In some centers, not here because we have limited resources, we will do 2 surgeries a day. For instance, next door at the QE2 on the adult side, we would operate until 8 o'clock at night, and then again stay and make sure the patient is stable. On days that we don't operate, that I don't operate, so I work for Dalhousie University as well, so we are basically called an academic heart center, so we do clinical work, doing heart surgeries, but also do other work for the university, like administrative work, teaching or education, or research, or leadership work. So that would entail teaching residents. So I have certain slots in my calendar that's reserved for teaching and spending time with residents that I'm the program director for. We'll be involved in research projects, doing research, reading manuscripts, writing manuscripts, and then a lot of administrative meetings as well. So no day is the same, but all the days are busy. So in general, those days would be anywhere from about 7:30, and I'll leave between 5 and 6 in the evening. I'm on call all the time, so if there's any emergencies after hours, then we'll address that. For the adult cardiac surgeons, they would be on call one day at a time, but their days would start the same, being in the operating room around 7:15, 7:30, operating till about 8 o'clock at night. And then when they do not operate, then we'll see clinic patients and also do the other academic stuff. For my schedule as well, once a week we'll see adult patients, and on Wednesday mornings we'll have conferences to discuss our pediatric patients.